160 kilometers away from Islamabad. Khui Ratta, a beautiful town of Pakistan-administered Kashmir, also known as Azad Kashmir, is located close to the ceasefire line between Pakistan and India. Khui Ratta is a combination of several beautiful villages. According to the United Nations, like other rural areas of Azad Kashmir, 54% of the population of Khui Ratta lives below the poverty line. The infrastructure is poor and the general health conditions are poor. Scattered population, mountainous terrain, and low income are the major causes of poor health conditions in the area. Azad Kashmir suffers from one of the highest infant and maternal mortality rates in the region. There is poor access to good quality and affordable health services, particularly in remote rural areas. Women and children tend to be most affected by the shortage of medical staff and unaffordable health services. In 2008, Rahma Islamic Relief Fund Norway took the initiative to establish a well-organized basic health center at Ratta.DAT village, the central point of Khui Ratta town. On Friday, 31st of August 2008, Mr. Malik Munir Ahmed, the founder-chairman of Rahma Islamic Relief Fund, inaugurated the construction work of Rahma Basic Health Center at Ratta.DAT village. The construction work of Basic Health Center was completed in January 2010. Since then, this health center is providing basic health care services to the poor communities of the surroundings. This center is one facet of a multi-pronged approach by Rahma to bring basic health facilities to those who need it most. The 5 rooms building is used for minor surgeries, outpatient visits, and laboratory and as a dispensary. For the community, this basic health center is their only local health facility, and all services provided are subsidized and free for poor and deserving patients. Currently, Basic Health Center is facilitating about 70 patients per day. These patients coming from 16 targeted villages, comprising a population of over 50,000 in total. This center is providing curative care for common illnesses and general health checkups, including first aid and minor surgical operations, with provision of essential medicines absolutely free of cost for poor and deserving patients, as per the advice of doctors. This center is also providing the services of ECG, ultrasound, and microchemistry diagnosis free of cost for poor and deserving patients, while nominal fee is charged from the rest of the patients who can afford it.
मेरे हिसाब से कुछ ऐसे भी मरीज आते हैं जो कम से कम 10-12 किलोमीटर ही सफ़र करके आते हैं। लेबॉरेटरी का मामला वो भी ठीक चल रही हैं, अदालत वगैरह भी ठीक मिल रही हैं।
For women and mother health care, this basic health center is also providing the services of a lady doctor. The deployment of female health staff in the health center has enhanced access to health care by women, some of whom saw a female health provider for the first time in their lives.
2003 में उल्टी शुरू हुई तो बे मैं विजिट गई थी इतनी उल्टी के पूछो मत उधर में कोई इन्फेक्शन हुआ अंदर जो चीज़ मैं खाती और मैं तकरीबन 2 मिनट बाद उल्टी इतनी दवाइयाँ लेंगे इतनी पे मेरे पर पिंडी कोल्डी तो डॉक्टर सलीम साहब करूँ पर मेरा आराम नहीं आया इतों मैं 2 दफ़ा दवाई खड़ी है सिर्फ खाने तो बाद में उल्टी खत्म हुई है।
These female staff are also tremendous agents of change for Khui Ratta community. Since July 2010, the center has vaccinated about 750 children in the area who had never been exposed to immunization. It is the first health center that has ever existed in these valleys. Before Rahma set up this facility, it was taking people a minimum of 1 hour to make the journey to the nearest health center. From now on, mothers and children here will have immediate access to professional health services. Community health workers are the backbone of the primary health care. Rahma believes that personal health hygiene and maintenance practices have a key role to play in improving the health status of the population. In addition, about 30 women have been trained as traditional birth attendants, whereas 30 women and men have also been trained as health workers to enhance health awareness and essential health services at the doorstep. The anticipated outcome of the project was to help create an environment necessary to provide much-needed support to the poor women and children by addressing their health and hygiene protection needs. Let us join hands to develop these poor communities by bringing them proper medical support. Rahma acknowledges the support of all those whose unwavering support remained with us all through the way and never let us feel alone.